In 4 days from now, we will welcome 2022. The new year is almost here, but are we ready for what's coming? There is a consistent spike in Wuhan virus cases. Omicron is now a variant of serious concern. The United States is already struggling. Hospital admissions have shot up by 4 times in New York, and it's not adult patients who are driving these numbers. It's children. The numbers are worrying. We have data on hospital admissions from 5th to 19 December. Around half of the children admitted were below the age of 5. Remember, they're not being vaccinated. So they're more vulnerable. And this pattern is not limited to New York. Across the US, 170,000 children tested positive in the last 1 week. These are Wuhan virus cases. We don't know how many of them were of Omicron. But the trend, nonetheless, is disturbing. Remember, the vaccines for COVID were rolled out last year. In the last 12-odd months, countries across the world have not even managed to vaccinate all adults, not even those countries which have surplus vaccines. Vaccine politics and fights over patents continue. In the meantime, the virus has begun targeting our children. So I come back to my question. Are we ready for what's coming in 2022? How bad are things today? How fast is Omicron spreading? Are children now the most vulnerable population? Do we need new shots for new variants? And is Omicron going to extend the pandemic? The answers to these 5 questions will define 2022. Tonight on Gravitas, we'll discuss them. Let's begin with the latest. Question number 1, what's the global situation like? Well, not good, to put it mildly. Omicron is fueling a new wave of infections the world over. The new variant is driving up caseloads. Let me pull out our Omicron tracker for you. The variant was detected 1 month back, and since then 117 countries have reported confirmed cases. How many cases? At least 188,000 people worldwide have been infected by Omicron. How many people have died due to this variant? Around 32 so far. That's not even 1%, which is good news. What about India? 20 states and union territories have confirmed cases of Omicron as of today. 20. How many cases? Almost 600 now. Delhi and Maharashtra together have more than 280 Omicron cases. So that's where things stand. Tens of thousands of cases in every corner of the world. At this rate, Omicron will become the dominant strain soon. Which brings me to question number 2. How quickly is the variant spreading? Very quickly. 1 patient infected by Omicron can infect more than 6 people. Let's put that number in context. Delta's reproduction rate was estimated to be around 5, meaning 1 person could infect 5 other people. For Omicron, that number is higher, and that's evident in global hotspots. In the United States, for instance, Omicron is already believed to be the dominant strain. The country is reporting 200,000 new cases every day, 2 lakh cases a day in the US. And the surge has led to a shortage of healthcare workers. Here are some numbers from Christmas. In 13 states, more than 25% of the hospitals are struggling. They don't have enough doctors and nurses to treat the growing number of patients. Same with Europe. Today, France reported more than 100,000 new infections. The UK had 122,000. Health workers are overwhelmed. The cases are shooting up, and doctors and nurses themselves are falling sick. More than 3,800 of them are now at home. And this includes those who've tested positive, also those who've had to self-isolate because they came in contact with a positive patient. Also hit is the global economy. More than 7,000 flights had to be cancelled during Christmas weekend. But airlines, we can tell you, are not the biggest victims of Omicron. We come back to children who are ending up in hospital. And that's question number 3. How contagious is this variant for children? Remember, children are vulnerable. They don't have the protection of vaccines. We have some preliminary research from South Africa. It says children face a 20% higher risk of hospitalization. Now, new infections in South Africa have in fact dropped. But as the virus spreads across the world, more children are indeed getting infected. The surge in the United States is perhaps the most alarming. The pediatric wards began filling up before Christmas. In 10 days, there was a 31% jump in hospitalization of children. This was the situation by 24th of December, and we are still waiting for the post-Christmas figures. There are similar worries in the United Kingdom, especially in the 5 to 11-year age bracket. Wuhan virus infections in this age group are 3 times more prevalent than adults. Does that mean more fatalities? Well, not necessarily. There is still no data set, not enough data, that shows that Omicron is deadlier than any other variant. And that applies to children too. Remember, the Wuhan virus is not proved to be as dangerous for children. Omicron has been no different so far, but I must underline here, we need more data to confirm any trend. What is beyond doubt is the fact that children are at risk and that children need vaccines. Question number 4, does that also mean we need to develop a new shot? Well, the jury is still out on that one. Existing vaccines give some immunity against Omicron, but their efficacy reduces over time. At least 50 countries are giving boosters now, and they're using the same old vaccine for the booster dose. We're told these boosters do give increased protection against Omicron. Over the weekend, Prime Minister Narendra Modi of India also announced booster shots. He called it a precautionary dose. Well, who qualifies for this precautionary dose in India? Health workers, doctors and nurses, and those above 60 years of age with comorbidities. Those who got their second dose 9 months back. They can get another shot in India now. Again, India would be using existing vaccines for the third dose. India is opening up vaccination for teenagers as well. Those between 15 to 18 years of age will be given Covaxin. This is the same shot that adults got. There are some vaccine makers who are considering modifying existing shots, but as of today, it's too early to expect a new shot for Omicron. Which brings us to the final question. Is Omicron going to extend the pandemic? It looks like it. In the immediate future, the Wuhan virus is not going anywhere. Omicron will fuel a new wave of infections across regions. But we'll need better ways to deal with future waves. So what do we do to end this pandemic in 2022? World leaders are staring at a long checklist. Vaccinations help in preventing hospitalization. That is a fact. So we need to get vaccines to those regions which do not have enough. We need vaccines for children below the age of 5, and vaccines alone will not be enough. We also need to be better prepared for future waves, which means better containment strategies, more effective testing methods, access to therapeutics, and more beds in hospitals to treat patients, including children. 2021 was a patchy year. Global inequities have only prolonged the pandemic. In 2022, we can only hope for a better coordinated global response to the pandemic, without which humanity has no chance whatsoever of defeating the Wuhan virus. WION is now available in your country. Download the app now and get all the news on the move.